Hi, I'm Dr. Hackey Reitman. Welcome to another episode of Exploring Different Brains here at differentbrains.com. We have the pleasure today of talking to my friend, Dr. Lori Butts, who in addition to being the founder of the Clinical and Forensic Institute, Inc., is one of the few psychologists with her doctorate degree in psychology and also a law degree. Lori, welcome.
Thank you. It's a pleasure to be here, Hackey.
Let's talk about different brains in general and see if my thesis coincides with how you see it. It seems clear to me that, especially I've just got back from speaking at the Aspen Brain Lab at the Aspen Institute, and it really seems like there's so many commonalities between, just picking at random, Alzheimer's, autism and Asperger's, bipolar, depression. How do you see it? Do you see mental health issues the same as intellectual disability issues, regards to neurodiversity and maybe neuroplasticity? Do you see neurological disorders like Parkinsonism and the overlap into Alzheimer's? And because I don't see anything occurring in isolation. Everything's got comorbidities.
Right.
How would you sort out the jumble that I just said?
Well, there's a lot of pressure in my field in particular to label things and to give an accurate diagnosis. I mean, in graduate school, you learn diagnoses, and these are the criteria for the diagnoses. And I understand that so that we can speak a shorthand so that people can speak about what different people are suffering in a shorthand version. But I like to, if I had a choice, I would prefer to talk about symptoms, not labels. So somebody is having executive function problems, somebody's feeling sad, depressed, and hopeless, rather than just a label. Because somebody with two people with autism can have a completely different set of experiences than each other, but yet they still have the same label. So the label's not really, it doesn't give us any information. The information we want is, what is the person struggling with, so that we can intervene in that area. So we can give them skills in this area, so we can give them skills in that area. And yeah, when you boil down the skills that we're giving people, they're all pretty similar. We tailor them to somebody's individual needs, but when you take a broad brush, there are a lot of things that as human beings we know make you feel better, think better, and are happier, and all of those positive things.
What is the one thing that you think a layperson like myself, who's not in psychology the way you are, doesn't get about mental disorders and intellectual disabilities and different things that you are involved with? What would be a big surprise to them if you could think of something that they just don't, that the average person just has no clue, but you know it because you're in there every day?
I think that that we are more comfortable distancing ourselves from people who have mental illness because it keeps us safe. So when you make a distance that it's somebody else, it's never going to happen to me, I don't have those problems, it keeps you psychically safe. It's like it's a defense mechanism. So I think that our communities need to recognize that you don't, well, a couple things. One is, you don't need to have a label of a mental illness in order for techniques that we use in psychology to help make your life better. And it's not only for quote unquote sick people that we can give you resources and skills to enhance anybody's life, and that it doesn't have, because somebody has been diagnosed with a mental illness, it doesn't mean that's a life sentence, that they can't accomplish anything. I mean, you know, people rise above, they get treatment, they move forward. And clearly with the statistics with the different people that are taking antidepressants, anti-anxiety medication, there's lots of people functioning well in our community that don't talk about their mental health issues, but they are clearly getting treatment for their mental health issues and they're functioning appropriately. I think right now, one of the biggest myths is that mental illness is associated with violence. It's not. I mean, there are these, you know, very famous statistical points, but people with mental illness are no more likely to be violent than people without mental illness. The real issue, one of the real issues, the strongest variable associated with violence is substance abuse. So substance abuse is more likely to be related to violence than to mental illness.
I didn't know that. There's something I know. Now we've learned that. That's great. So when we interviewed William Packard, who wrote the book on intellectual disabilities in the justice and prison system, what was startling to me, but kind of goes with what you're saying a bit, in a way, is in the prison system, I forget the exact numbers, but I think he was saying between 50 and 70% of the prisoners had some kind of intellectual disability or mental disorder or something of that nature. But then he said the staff there and the guards are probably up in the 50% range themselves, and that there's kind of a fine line there. Do you have any thoughts on that? And I might be quoting the statistics wrong, and I don't mean to heap any aspersions on any officers or people who staff prisons, and there's a lot that goes under the roof of intellectual disabilities. I call them, and our website's called differentbrains.com. And I think if you add up just the people in this room, I don't think any of us are neurotypical, you included. That's right. And, you know, if you start adding up the 1 in 5 Americans on anti-anxiety medications, and PTSD, 1 in 13 Americans, and OCD, and ADHD, and autism, Asperger's, depression, bipolar, I mean, the list goes on and on and on. So putting this in the context of prisons, and you're in prisons a fair amount, what's your experience been? Have you had much exposure to the staff and guards?
Sure, and I'm actually going to be doing a presentation to probation officers coming up soon to talk about vicarious traumatization. So what happens is people in law enforcement get vicariously traumatized through reading, experiencing, learning about heinous crimes, investigating heinous crimes, seeing photographs of crime scenes, or being involved in community monitoring, experiencing things in the community. And so there's, which is wonderful, there's research and data to talk about what people haven't talked about in many years. It's just, prosecutors, judges, defense attorneys. I mean, all of these professionals who have committed their lives to being involved in the criminal justice system are also getting vicariously traumatized through experiencing and hearing about, heinous things that happen to others. And so we need to make sure that there are resources for people. People aren't embarrassed to talk about what's going on with them. We want to reduce burnout. So that contributes to burnout. It contributes to people making poor judgments. It contributes to people being angry, being irritable, quick to pull a trigger, or quick to yell at an inmate, or, all kinds of those things that are very, very subtle, because it doesn't happen in just one day. It's just kind of this progressive experience that people have where, they just become a little irritable, a little angry, a little short-tempered. And when we're like that, we're not at our best. We're not using our brains the best. So we need to to let people that are on the professional side in the criminal justice system, give them skills and opportunities so they can, take care of themselves and not react poorly in very difficult, stressful situations.
Where do you see the future of psychology going?
Well, I mean, obviously I'm a big proponent of psychology. I feel like psychology is involved in every aspect, right? Involved in business, involved in organizations, involved in healthcare. And it's a science. So it's a science. We've got science that can help all different aspects of human domains and functioning in our community. Psychologists need to be doing a better job at letting people know what we have to offer various stakeholders in our communities, and how much we can really add to, and especially in healthcare. I mean, we have so much to add as an adjunct to physicians, from orthopedics to cardiac to, you name it. Sports. Sports psychology is really, I listen to when they interview elite athletes after games, and I would say 100% of the time they talk about my mental focus or my head in the game. And when you're at that level, that is the difference. The mental game is the difference. Everybody is strong enough, everybody's fast enough, but it's the mental part in athletes that really separates the winners from second place. So I find that very fascinating, and and people don't talk. It's not so publicized that's psychology. That's what we do, and we've got research to help out elite athletes. So I think that the future for psychology is more integration, more access. We certainly need and less stigma, so that people are not afraid to go to the shrink. It doesn't mean that they're broken or that they have mental illness for the rest of their life. That it's an addition. It's an addition to your life. It's a way to help you problem solving. You don't have to be in therapy 10 times a week and to solve a problem. It can be quick and just somebody to assist you in working through a problem.
Well, we have to get rid of the stigma for anything that's wrong with the brain, And plus, these are invisible problems as opposed to if you're in a wheelchair or something like that. And for the person who's seeing a shrink, it's almost like being gay 50 years ago. It's like you got to stay in the closet. Don't let anybody know. Don't let your boss know. Don't let your colleagues know. Right. And we have to get rid of that stigma. I want the President of the United States wear a T-shirt that says, "My brain is different." And we'll see.
We'll get there. We'll get there.
We've had the pleasure today of speaking with Dr. Laurie Butts, who is the founder of the Clinical and Forensic Institute, Inc., and the past president of the Florida Psychological Association. Laurie, thank you so much for being here.
Thank you so much, Haki. It was a pleasure.
For more information, visit us at differentbrains.com.